All right, hello everybody. This is going to be part 1 for chapter 12 in your Pharmacy Practice for Technicians book. And chapter 12 is covering infection control, aseptic technique, and clean room facilities, which is pretty much going to be centered around pharmacy technicians compounding sterile products, so IV medications, sterile eye drops, that type of thing. So we first start off with just kind of defining what microorganisms are and the different types out there. So there's bacteria, viruses, fungi, and protozoa. A bacterium is a single-celled microorganism. There's 3 different types of shapes, if you can see that on slide 6, that shows you what those shapes of those different bacterium look like. Bacteria, so there's a normal skin, your normal skin is colonized by several different bacteria. They cause us no harm unless maybe we have a scrape or a cut, and then they have an opportunity to, then enter our body. Some bacteria are pathogenic, which means they're potentially harmful. And then some are non-pathogenic, which means they are beneficial or neutral. So for example, non-pathogenic bacteria for us would be the examples of the bacteria we have in our intestinal tract. That is important that we have those bacteria inside of our intestinal tract, because that is what helps break down our food and eventually turn all of that into our waste. They do not cause harm within our body. Typically is for females more especially are more at risk for these type of bacteria, because when they are passed through our fecal matter, depending on how females are wiping, they could potentially spread that bacteria to their urethra, which will then cause a urinary tract infection. But overall, these bacteria are not designed to be harmful to our body, but beneficial. Bacteria that are pathogenic would be the ones that cause things like food poisoning, strep throat, ear infections, rheumatic fever, pneumonia, any type of bacterial infections like that. A virus consists of genetic material enclosed by a casing of protein. Viruses do need a living host to reproduce, and different types of viruses include colds, flus, polio, mumps, measles, chickenpox, shingles, influenza, HIV, the Zika virus, and now the coronavirus. So it's important to understand that antibiotics are to treat bacterial infections. Antivirals are used to treat viral infections. You cannot use either or. Antivirals will not treat a bacterial infection, as antibiotics will not treat a viral infection. Fungus lives on organisms. They feed on either living or dead organic material. They reproduce slowly by spores. They can cause deep systemic fungal infections. One of the most common fungal infections that we see here is called valley fever. The spores of that fungus are in our dirt. And for any of us that have lived in southern Arizona for any length of time, we have had valley fever. Typically it's like a mild cold. It settles within our lungs, and we get over it, and then eventually we build up an immunity to it. So for our population, like our elderly or what we call our snowbirds, when they come into Arizona to get away from the harsh winters in other locations, they're at higher risk for developing valley fever. In fact, there's a lot of cases where these individuals go back for the summer to wherever they came from, because their summers are not as hot as ours. And some of these patients have been mistakenly diagnosed with lung cancer, because those doctors in those areas, they're not trained to look for valley fever, because it's a more specific geographical location that comes from. And so until they say, well, I winter in Arizona, then the light bulb goes off. Other types of fungal illnesses include athlete's foot, ringworm. Yes, ringworm is a fungal infection. It is not a parasite. And then vaginal yeast infections. Protozoa are single cells or a group of individual cells. They live in water or as parasites inside of other creatures. They can cause illnesses such as amoebic dysentery, malaria, and sleeping sickness. So with malaria, one of the things that has come up is one of the medications that is used to treat malaria is being used to treat or is in a clinical phase to treat COVID-19. But with malaria, the parasite or protozoa is passed through the mosquito bite. So in areas where these type of protozoa live to cause malaria and are spread through mosquito bites or other insect bites, that's where you'll see a heavy use of like mosquito netting and stuff like that. So a lot of times people in the United States get malaria, and that's because they've traveled abroad to areas where malaria is existent. So the effects of microorganisms. So again, non-pathogenic means they're not designed and they do not pose and cause us any harm. And they do perform some essential functions. So again, reestablish our normal flora within our GI tract. They can help reduce diarrhea as a side effect from antibiotic use. And they create byproducts to help formulate medicines, ferment wine, fix nitrogen in the soil, and help break down various foods. Pathogenic microorganisms lead to illness and disease throughout the world. And then we have epidemic versus pandemic. So epidemic is it's located, it's sealed within a specific border, and pandemic, as we know, because of what we're going through now, has spread globally from countries to continents and so on. Epidemic is an increased incident of a particular disease in a given area or among a certain group of people over a specific time or period. Pandemic is an epidemic that is spread beyond the borders of a country, affects a sizable population of several other countries. So some other examples of pandemics have been the bubonic plague, smallpox, cholera, influenza, particularly the Spanish flu of 1918, the Zika virus, and of course HIV, and now COVID. So antimicrobial resistance. So microorganisms actually adapt rapidly, and they can become and do become resistant to medication and also sterility techniques. So if medication kills the majority of a colony of an infectious microorganism, the remnants of the colony may only be weakened by the medication. So the remaining organisms will then reproduce, and they will yield a new strain of that organism that is not affected by the medication or not as affected by the medication. So antibiotic resistant bacteria are also known as superbugs. This is something that you're going to see coming up in a couple videos you'll watch later on. So one of the things that we talk about is healthcare associated infections, or HAIs. These are infections that are contracted while in the hospital or in a nursing home or a long-term care facility. May be caused by medication-resistant bacteria such as MRSA, and the immunocompromised are particularly at risk for this. So what happens within a healthcare-associated infection is that you can have a normal, healthy person like myself go in and have a surgery, and I have to spend 24 hours to 48 hours for post-recovery in the hospital. And during that time, if the room is not cleaned, if the nurse is not washing or the doctor is not washing their hands in between patient rooms and touching patients, one person uses a glove in one room and doesn't change them into another room, that's how these infections spread. And most of them are antibiotic resistant because they are within that hospital or that long-term care facility where they've had time to develop the resistance to those antibiotics. So sources of contamination, okay, so we have touch, which is the most common form or source of contamination, so specifically on the skin and under the nails. This is why you cannot have artificial nails, okay, in any healthcare facility. Now I know you're going to go to a retail pharmacy and see some of these technicians with some really long, pretty impressive nails. That's because they're not doing specifically sterile compounding within that. In a hospital setting, you have nurses who are touching patients, you have janitors that are cleaning different rooms are going in between room and cleaning. They're also cleaning the operating rooms. Pharmacy is making IVs. So you can see that type of having that additional nail and the space there, it can harbor the bacteria underneath. They have also banned gel nail polish, regular nail polish, and not so much because of the spreading of bacteria, but the risk of contamination because these things can flake off of the fingernail. So preventative measures for touch include scrubbing the hands and fingernails, following strict aseptic procedures, and using disposable gloves. Air, so airborne dust particles and moisture droplets. So, coughing, okay, that develops moisture droplets that are spread through the air. That's one of the ways that COVID-19 is being spread. So you want to prepare sterile products where contaminants are maintained at a low level. These IV rooms in particular are at certain pressures, certain temperatures to help prevent any of that from happening. Water, so tap water, water droplets, protective plastic shields on equipment, the use of face masks, not preparing sterile products when you feel like you are sick or if you have a cold, anything like that. So you want to make sure. Tap water they bring up because in the United States we actually treat our tap water. In other parts of the world they do not, and so you will be told if you do any outside of the country traveling not to drink their tap water, to always drink bottled water. And one thing I learned from going on a cruise to Cabo in 2017 was that also includes the ice. So they use the tap water to freeze the ice, so frozen margaritas and ice in your iced tea or in your sodas or in your water. You can still potentially have contaminants contracted that way. So the Centers for Disease Control and Prevention, known as the CDC, it's probably something, if you've been watching the news, you should know who this entity is by now. They provide national guidelines and recommendations on infection control. They publish reports on bacterial sensitivity and resistance. So these are things that the CDC is monitoring. They also set the guidelines for vaccinations of healthcare workers. So not just vaccinations for us in general, pediatric, vaccinations for children as they're growing up, what vaccines we need as adults, or revaccinations or boosters as they call it, what types of vaccines you should get if you are traveling abroad to certain locations. But in particular, they have a set of guidelines for individuals who are healthcare workers. One of those requirements that you're not going to be able to get away from if you work in any type of healthcare facility, hospital, nursing home, long-term care, anything like that, rehab facilities, is you are going to have to prove or get a hepatitis B vaccine. They also provide universal precautions, which is the guidelines to protect patients and healthcare workers from the transmission of infection from contact with blood or other bodily fluids. Universal precautions, so using disposable gloves must be worn when contact with blood is anticipated. Hands must be washed thoroughly after removal of those gloves. Any blood-soaked materials must be disposed of in a wastebasket sorry, I have a little fly buzzing me here. In a wastebasket lined with a plastic bag. Properly trained custodial personnel must be called if a cleanup or removal of waste is necessary. Okay, they are trained specifically in how to do that. Contaminated materials must be placed in red plastic containers labeled for disposal of biohazard materials. So hospitals can get fined large amounts of money if an inspector comes in and they find any type of blood-soaked products, gauze, Band-Aids, anything that has blood on it has been disposed of in a regular container, not a biohazard container. First aid kit must be kept on hand in any area in which contact with blood is possible. So we even have first aid kits in the pharmacy because even though we're not puncturing patients, we are still working with needles and manipulating needles and syringes, and we can potentially stick ourselves. All pharmacy personnel should receive an annual flu vaccine to protect themselves, both themselves and their patients from contracting the virus. So there are some patients or individuals that can't get the flu shot because they do have an allergy to eggs. But be prepared that if you're planning on working in a hospital setting, nursing home, long-term care, that they do require you to get a flu vaccine. And if you refuse, they're going to require you to wear a mask pretty much from October through March. And you have to show pretty much some really strong reasons why you don't want to get that. It's not only protection from you, because when our patients get very, very sick, where do they go? They go to the hospital. Where are you working? You're working in a hospital. But we also run the risk of spreading that to the other patients within the facility. This, I do believe, is going to be the exact same thing for COVID. Once they develop a vaccine for COVID, because of the high instance or high ability for this to spread and spread so quickly, they're going to require healthcare workers to get that vaccination. The Infection Control Committee, we're going to stop after this slide, so slide 19. Each hospital has an infection control committee that is responsible for following the CDC guidelines. So this committee will develop hospital-specific policies and procedures that are specific to that facility. A pharmacist, usually a clinical pharmacist, maybe the director of pharmacy in the hospital, will participate in this committee. This committee documents all incidences of healthcare-acquired infections, also known as nosocomial infections. They will investigate outbreaks from beginning to end. They're going to really go through and try to figure out how did the outbreak happen, where was the source of contamination. They will track local patterns of resistance to antibiotics. So maybe a particular bacteria here in Arizona we're seeing is more resistant than it is in other parts of the world. And then they will make recommendations about infection control. Part of the no nails and artificial nails has come through infection control committees and has been taken all the way up through the CDC, and has also been part of a Joint Commission requirement. So Joint Commission is an accrediting body. Any facility that accepts Medicare or Medicaid patients must be accredited by Joint Commission, and one of their requirements or guidelines is having an infection control committee, and also the banning the use of artificial gel and nail polish nails. The requirement for these facilities to be accredited by Joint Commission is if they are not, and a patient is seen who has Medicare or Medicaid we call access in Arizona, if they're not accredited, they will not receive reimbursement for that patient from the federal government. All right, so we're going to go ahead and stop there. If you have any questions, make sure that you give me a call or send me an email, and I would be glad to help.